China is among the last remaining devotees to a zero COVID approach to the pandemic. It was here that the coronavirus was first detected in 2019. China saw virtually closed borders, mass testing, targeted lockdowns, and quarantines for over 2 years owing to the pandemic. With millions currently under lockdown, can China's approach hold out against the march of the Omicron variant? Let's take a look at the current situation in China. At the moment, people in China can be banned from leaving their building or forced to remain inside a hotel room if they are considered high-risk contacts. Track and trace apps are mandatory. Shops, schools, tourist sites, office blocks, and malls have been summarily locked. Residents are forced to stay at home at a moment's notice. Officials are routinely dismissed or castigated in state media for outbreaks in their areas. International flight volumes have also collapsed. The government said it will not renew expiring Chinese passports unless the holder has a good reason for travel. But China's caseload since the start of the pandemic is a fraction of those recorded elsewhere. The country has recorded just over 1,115,000 cases, and the official death toll has stayed under 5,000. What do the country's leaders believe? Beijing's communist leadership has made its handling of the pandemic a matter of political capital. The leadership said the low death rate demonstrates the strength of its governance model. Loosening virus restrictions could also prove risky for President Xi Jinping as he seeks a third term in October after billing himself as a leader who keeps China safe. But zero COVID comes at a cost. Analysts say that repeated shutdowns of factories and businesses have contributed to the slowing economy. Lockdown communities have complained of poor access to food, supplies, and medical treatment. Migrant workers have been left stranded from their families for months due to many travel restrictions. So what could be the way forward? A top Chinese scientist said this month that China should aim to coexist with the virus. The Chinese government also announced that it was introducing rapid antigen tests for the first time, which would allow at-home testing. There continues to be concerns over the capacity of the country's healthcare system and the efficacy of domestic vaccines. Peking University researchers have warned that China could suffer a colossal outbreak that would overwhelm its medical system if it relaxed restrictions to a similar level as in Europe and the United States.